Welcome back. Well, it's no secret that Michigan has an opioid epidemic. According to the U.S. Centers for Disease Control, more than 52,000 people died of overdoses in 2015. And while there's been a concerted effort to address this devastating addictive disease, it still impacts families in every community across our state. So in today's Health Yes segment, we're focusing on information and resources centered around the opioid drug epidemic. So here to tell us about those treatment options that are available to you is Patty Wagenhofer-Rucker and Carol Donnelly with Genesee Community Health Center. Thank you both for joining me today. First of all, we want to talk about why do we have this opioid epidemic? Why is it spiking recently?
Our opioid epidemic is similar to the rest of the country, and just the fact that opiates are available for us for use, is the cause for the opioid epidemic. There's a lot of finger pointing and blaming going around. There's blame on the physicians. They're saying that they're handing them out like candies. People are also blaming the pharmaceutical companies because they manufacture, the way they market these pain medications. Some are pointing to government entities. We have like JCOs that have implemented some rules like 20 years ago that we need to aggressively treat pain. And at that time, the belief was that opioid analgesics rarely affect or lead to addiction, and now we know that that's not the case.
Right.
So also, it's up to the end user too. Sometimes the patients misuse or overuse and abuse the pain medication that's prescribed to them.
Okay. Now, what is Genesee Community Health Center? What are you folks doing to help save lives and help fight this epidemic?
So over the last year, we've handed out more than 1,500 Narcan kits. Those Narcan kits reverse an opiate overdose, and we have documented over 30 saved lives with that.
Wow, that's wonderful. Now, this is very important to know, but what kind of treatment is available? You mentioned the Narcan. Is there any type of other, counseling or for families? What can folks do if they're just starting out on this journey and want treatment?
So we believe that there's multiple pathways to recovery. There's many different ways that people can get better. At Genesee Community Health Center, we offer two different types of medication-assisted treatment. One is Suboxone and one is Vivitrol. And Suboxone is something that you take on a daily basis that addresses withdrawal, and Vivitrol is a once-a-month injection that addresses cravings for alcohol and opiates.
Okay, now what is the role of health coaches at Genesee Community Health Center? What do they do when somebody reaches out?
Their job is to provide hope. They provide a lot of emotional support. We know that 60% of, we need to address people's social needs, and 60% of the health outcome is related to addressing their social needs, such as having access to food or shelter or getting a job and other things like that. And so they provide support in those areas.
So what would you say to folks who may, be scared to reach out or may not know what to do next?
Just come in. We are always, welcoming people. We don't treat you any differently. We don't judge you coming in. We're going to listen.
Right.
We're going to work things out with you. We have nurse practitioners, and we have psychiatric nurse practitioners. We have health coaches, social workers. So it's an integrated healthcare. You're not just going to come in and get a prescription. It doesn't work that way. We have a whole team that will kind of support you with your recovery.
Wonderful. All right, thank you both for being here. Remember, you can catch Health Yes the second and fourth Thursday every month right here on TV5 News at 9. And Patty, Carol, and myself will be doing a Facebook Live talk back right after the news here at 9 to answer any questions you may have in real time.